Hey, how you doing? It's Dr. Morris from Magnolia Medical. I got my coat on, getting ready to head out. It's a little bit cold here in Middle Tennessee. It's probably I don't know, in the high 20s, low 30s. So listen, I wanted to tell you all this. This is exciting, right? So last week, I meant to tell you all about this last week, but last week I had somebody post on one of my. They responded. They put a comment on one of my posts, and they said that our clinic and our page, meaning our clinic and this Facebook page that you're all watching right now, is a danger to society, right? And I thought, wow, what a great compliment. I love that. And so this guy, I don't know exactly, I don't know who he is. He doesn't even live in this area, but I'm not going to say his last name, but his name is Edgar, right? And he made this post and he said, this page and this clinic is a danger to society. And I thought, man, this is awesome. I love getting that hate. So here's why. Okay, so we are a medical clinic. We have a medical director, we have two nurse practitioners, and we're looking to hire a physician's assistant. We do almost everything that we do is for on a natural health care basis. So we're trying to help people fix their body without drugs and surgery. Now, I thought, wow, this guy doesn't have much of a clue, right? It's not that medicine out there isn't going to help people. If I got hit by a bus, I don't want you to come take me to my clinic, right? If I got a gunshot wound, if I got a life-threatening infection, I'm going to need to go to the hospital, right? We have the best acute care in the world. We have the best acute care in the world. Nobody else on the planet has better health care than we do. But this guy said that our clinic, Magnolia Medical, is a menace and a danger to society. So let me just go over some statistics with you, Edgar. There was a study done, and it was published. It was done by a bunch of people a bunch of doctors that worked in the hospital, and it's called Death by Medicine, right? And what they did is they analyzed all kinds of. I mean, this is one of the most well researched and indexed articles you could find on the state of healthcare in the United States, called Death by Medicine. And Dr. Gary Null was the main publishing guy on this. And all he did was look through studies that had already been done. And he found out that medicine or trips to a hospital for anything kills between 800,000 and a million people a year, which easily makes it the leading cause of death on the planet. And guess what? Magnolia Medical has never killed one single person. We've never had somebody get worse from what we do in our clinic. Not one time. Been practicing for 23 years. And that study by itself shows that, now I'm not saying don't go to the hospital. I want to go to the hospital if I get hit by a bus for acute care. But for chronic health care, statistically speaking, going to the hospital for anything is the leading cause of death in the United States. Not my opinion. These are doctors that work in hospitals that did the research on that and published it working in that facility. Now, on top of that, you have a study that was done, published in 2013, and they found that chronic health care in the United States, meaning not disease care in the United States, is easily, our health care in this country is easily the most expensive and gets the worst results of any industrialized nation. Okay, so it's the most expensive. We're 4.25% of the world's population, and we outspend the rest of the world combined on healthcare every year. And whenever I ask doctors, nurses, healthcare professionals, as well as the public, if they think that our system works, every one of them says no. We're way overdrugged. We're way over medicated. There's way too many surgeries being done. And so I've got this guy, Edgar, saying we're the danger to society. And I laughed at that. Now, combine that with another study that was done. Okay, this was done by Dr. Barbara Starfield and was published in the Journal of the American Medical Association in the year 2000. Dr. Barbara Starfield was a head of health. She was a master's in public health. She was a physician, and she was a director of healthcare policy at Johns Hopkins Medical School. Okay, and she published a study that was called, now I'm going to forget the name of the study. Anyway, she basically just looked and said, is America healthy? All right. And when she published the study, she found that going to the hospital was the third leading cause of death in this country. Right. So it was responsible for killing about 275,000 people a year going to the hospital. And when she did the study, she did not include, her research did not include anybody that had died from all the things that she had quoted in her study, published in the Journal of the American Medical Association, from the nation's medical school, Johns Hopkins, considered the nation's medical school, and that was published in JAMA. And she didn't count anybody that died in an outpatient setting or a surgical center, only in hospitals. She said if I included the statistics for outpatient settings and surgical centers, it would easily have been number one. Okay, meaning like medicine in this country being the leading cause of death. So, listen, whoever you are, Edgar, the guy who said that we're the menace, we're the danger, I am happy you said so, because if we are not doing any of that, and that means we're the danger, I'd be happy to be called that every day. Because when people come to our office, maybe they have to pay more out of pocket because the things that we do might not be covered by their insurance. Maybe we're not going to provide them a script that they become addicted to. Maybe we're going to try to get them off of medications. Maybe we're going to teach them how to eat healthier, how to take care of their body better. But I can tell you what, that's healthcare. That's not sick care. And darn it, I'm really happy. I was actually thrilled. I chuckled to myself when you said our page and our clinic were a danger to society. And if that is true, meaning if what we do, and that's how you qualify it, I'll take it. I'll take that. I'm not sure how you're coming up with that information, but I've got all the studies to show that that what we're doing works. Patients come here and we have an amazing success rate. Sometimes they don't like what we do. They don't like us telling them they have to kick Dr. Pepper to the curb, right? You know, Dr. Pepper might taste really good, but he ain't going to help you live healthier, right? Maybe you're going to have to change the medication you're taking. Maybe you got to get off that gabapentin, or you got to stop taking that omeprazole. The doctor said you got acid reflux and didn't even look at what could cause the acid reflux. So I'm happy to question the status quo. I am happy to challenge it. I'm happy to fight against it on behalf of the people who are dying in hospitals for care that they could have gotten better care for if they came to a clinic like ours. I am really, really, really happy to fight for that all day long, and I will keep doing so. We're going to get as many people better as we possibly can. If you have an acute problem, you should be happy that you live in the United States. Statistically speaking, we have the best acute care in the world, but we have, according to the World Health Organization, right, Division of the United Nations, according to the National Institute of Health, the Institute of Medicine, National Institute for Medicine, we have the best acute care in the world. But every study ever done on chronic health care in this country shows the same thing. We are failing miserably. All right. And there's no way, if we're throwing the amount of money we are every year, year in and year out. Last year, 2018, it was almost $11,000 per every woman and child in this country we're throwing at healthcare every year. And yet we're consistently ranked the sickest, most disease industrialized country on the planet. You got to admit that your system that we call the American healthcare system, Western medicine, is not working. And I'm happy to get on a soapbox. I'm happy to yell it from the top, yell this data from the top of the Empire State Building if we have to. I don't care. I'll get on the news and talk about it. Our system does not work the way it is, and so if we're the danger, I think that's laughable. But all that means is you have not looked at the research. You're buying into the commercials on how to spend more money on medications. You're watching these commercials say, hey, buy this Enbrel or this new medication for this autoimmune disorder. And nobody's trying to fix anything. They're simply trying to treat disease and line the pockets of the pharmaceutical companies, the insurance companies. So if we look at all the industries, by the way, this is another thing that pisses me off, right? So if you look at the industries who make the most money, right? And I don't mean just the profit to the shareholders and the executives, but the CEOs in this country who make the most money from as an industry, right? The CEOs that make the most money, the top three are going to be pharmaceutical CEOs, right? The guys who run the pharmaceutical companies. And then you're going to have the CEOs that run insurance companies. And then you're going to have the CEOs that run big hospital corporations. So across the board, you have some of the highest paid people in the world, and they're all sleeping together, right? How is it possible that those three industries, hospital CEOs, pharmaceutical CEOs, and insurance company CEOs, are the highest paid, right? And our system sucks so bad. People are so ill. They have no ability to take care of themselves because they're so misfed wrong information all day long. So anyway, I'm a little bit amped up right now. I'm gonna sign off before I start using some foul language. Let's do me a favor, hit the share button, hit the like button. I saw you all giving me a bunch of hearts and likes and those little hitting those little buttons there. But share this, share the hell out of this, because I am happy if I am pissing people off and challenging the status quo in the system that we have, because it's BS. This system sucks and it needs to change. All right, so hit that share button for me. I appreciate all y'all watching this. I see we've had 35, 40 people watching this at a time. I really, really appreciate it. I hope you all have an amazing holiday, and I hope you have a healthy holiday. Don't let the holiday be a reason that you throw your diet and you throw your nutrition and you throw your exercise out the window. This is the time that you actually that you do better at those things, because it's a stressful time. It's colder outside. You're getting less vitamin D. Families coming over, they're bringing, the kids are bringing colds home from school. You need to be that much more on top of your diet, nutrition, and exercise right now than ever. So now's the time. If you can do it during the stressful times, during the holiday times, you could do it anytime. Be proud of yourself by actually sticking to it right now instead of falling off the wagon. Appreciate you guys watching. Again, hit that share button. It means so much to us when we share and we're able to help other people. Appreciate you. Merry Christmas, Happy Holidays, and I will see you all next time. If I don't, I may do a video before the end of the year. If I don't, then I'll see you in 2020. Bye now.